today's virtual practice workshop that we are doing alongside Viora. We are very happy to have definitely an expert in the industry. I actually did a webinar with her. We did a webinar together last year, so I'm very excited that she agreed to come back and provide you guys with some awesome information that she will be sharing today, which is Kara Moncrief. She is the Director of Clinical Communications for Viora, so we are very, very excited to have her here. For all of you who are joining, we'll probably get started here honestly, we'll probably get started pretty soon. We actually have a lot of people signing in here. My name is Audrey Neff. I'm the Director of Marketing for PatientNow, Aesthetic Now, RX Photo, and RX Marketing. We have a couple different brands under our hat with some recent mergers and acquisitions, so definitely lots of exciting things going on. But today's topic is, and Kara and I were actually just talking a little offline before this webinar. Today's topic is going to really kind of hone in on millennials. And I must say, every time we do a webinar around millennials, the importance of millennials, treating millennials, we get record attendance, record registration. So we had almost 400 people register for today's webinar, which is amazing. We had almost 500 people register for the last one I did last month. So we are very grateful for all of you guys for taking some time out of what I hope is a very busy week in the practice for you guys. So Kara will be doing a presentation first on Prejuvenation. She'll probably go 45 minutes or so. We'll do some live Q&A, and then I will close it out talking more so to the marketing and business side of converting, targeting, and connecting with the modern millennial patient. So with all of that said, I will pass it over to you, Kara.
Thank you. Hello, everyone. Again, my name is Kara Moncrief, and I am the Director of Clinical Communications. So I'm super excited, like Audrey was saying, about this, because it is kind of a lot of times when I go into our practices that have Viora, they kind of don't know that it's an untapped market and that they can do so much for those patients. So I'm really excited to share with you everything that Viora offers for millennials, and then I talk about some things that are outside of Viora as well. But we can get started. So the PowerPoint, Prejuvenation, age gracefully and gradually. So that's what we all want, right? When we maybe start in our 20s or 30s, if we're lucky enough to start then when we get into our 50s and 60s, we're not going to have to do too much because we have been aging gracefully and still looking like ourselves, just, you know, of course, our younger selves. So it is good to start early, and we'll talk about why and the type of treatments that, you know, that, oops, sorry, hold on, let me back up there, that millennials are looking for and what you can offer. So first, I just kind of want to give you an idea of who Viora is. So when I'm talking about these technologies, it will make sense. So what we offer is platform devices. And what that means is that we can build on a platform. So for example, I'm going to focus on these three to the right side of your screen. This is called the V10, this one's called the V20, this one's called the V30. The V10 houses all radio frequency capabilities. So we're going to be talking about a couple of our technologies that plug into that platform that do two totally different things. So it's not like you have to buy one laser for this, one RF device for that, one IPL device for something else. All of our technologies are integrated in one system. So very, very cost effective, and also space, of course. The next one over is called the V20. That houses all radio frequency capabilities plus IPL. And then the last one is all radio frequency capabilities plus IPL plus laser. So kind of the grand one where really anything that anybody's wanting when they walk into the office, you have the capability with that system. We will also be touching on this little device here to the left, which is our microdermabrasion, because that's going to be a huge benefit for your younger clientele. Okay, so just a brief breakdown. Now we're going to be talking about really the treatments that millennials are seeking or will be calling your office and asking if you have. So new target groups, and I kind of want to keep a theme with this with PatientNow, where we talk about different topics where new target groups, are you offering treatments that attract younger clientele? So you definitely want that. Otherwise, you're missing a huge percent of the a population out there that are, if they're not coming to you, they're going to someone else. But maybe the next one we can talk about males, and another sometimes untapped market, because maybe you just don't know what males are seeking and what they're wanting. So I'm hoping to keep this a theme as we do more webinars with PatientNow. Okay, so today, though, we're going to be talking about millennials and why, and the treatments that they want, why they want them, and also just a little bit about how you're going to target them. I am not going to spend a lot of time on that because Audrey is the expert on that. I am not. I am more clinical and practice development, where she's marketing. But kind of the main bullet points we have here for Generation Y or millennials is there's a size of generation eclipses the baby boomers. So the amount of them, it's so large. So you have such a huge patient database for millennials. Non-traditional generation, very much so, where they are seeking these treatments younger and younger and younger. I remember when I was 27 is when, 27 is when I first started to get Botox, and people thought I was crazy. My family's like, why? You don't need it. And even my friends, the same age, they're like, what do you mean you're starting to get Botox? And then after that, I started to do IPL skin rejuvenation. And it's like, well, why? You don't need it. And I would explain to them, when I hit the age I'm at now, which is 40, I want to stay on top of that collagen production. I want to make sure that when I start Botox young, I'm not going to create those really deep set lines when I get older. So it's was not very traditional then, but it's very, very common now. So definitely a time to jump on that. Expected 8% increase to the spa market by 2020, which this is a little bit older, I'm so sorry. So it's an even bigger increase now. Highly influenced by media and celebrities. Oh my goodness, I'm sure Audrey's going to touch on this, that social media is huge with this generation, and also celebrities and looking like celebrities. Now, of course, like you don't want, your patients to come in and say, make me look like X, Kim Kardashian. You're not gonna, go out of your way to do plastic surgery on them to make them look just like Kim Kardashian, but we can do non-invasive or minimally invasive treatments on them to make them happy, kind of get to what they're looking for without completely changing the look of them. And that's really what we want. And that just takes, conversation with them. And then think about social media. It's free. Like the best marketing is going to be free, and that's what they're on all day long. So I'm sure she's really going to hit home with that. And then mobile marketing is a must to capture because they're constantly on their phone. As we know, we probably all are too, but they're a bit worse. Okay, so millennial services, really, I'm not going to just be talking about preventative today. I'm going to be talking about other treatments that they're going to be seeking that's outside of preventative, and I will be talking about preventative measures as well. But what are they looking for? So preventative skin tightening. We're going to talk about microdermabrasion today. Hair removal, that's not preventative, but that is definitely something that they start much younger, doing hair removal. Acne clearance, of course, like that's not something that, oh, I just want to prevent aging, I want to start early. No, this is something that's happening to them now and that they want to get rid of so they don't have scarring in the future. Now, if they already do have the scarring, we do have treatment for that as well. Overall, just skin rejuvenation, I'm going to be talking a lot about that and what skin rejuvenation does for skin. Body contouring and cellulite reduction, of course, in our 20s, and when we're wanting to be in bikinis the most is usually in our 20s and 30s. Of course, we want to, contour those stubborn areas or get rid of cellulite. Injectables and fillers, I won't be talking about that today just because we're not the injectable filler market, but that is definitely treatments that millennials are going to seek. And then group party treatments are always a great thing for millennials, like throwing events and open houses in your med spa that's targeted just to them. It is really popular and has shown really good ROI. Okay, so the first technology I'm going to talk about is our microdermabrasion, and it's called the Pristine. So I have a video here. I wonder if it'll play. Let's see. Maybe if I go back and then start it over again. And play. I don't know why it's saying media not found. Okay, so sorry about that. I have a video showing how the microdermabrasion works, but I'll explain it. So ours is a diamond tip microdermabrasion. And what that means is that there's actually diamonds on the tips. The first generation of microdermabrasion, they used crystals, and crystals would then just blow into the skin and would exfoliate the epidermis, the most superficial part of our skin, which is really the stratum corneum barrier. The stratum corneum barrier and those skin cells in the epidermis turn over about every 30 days, so about every 4 weeks. But we have 15 to 30 dead skin layers in the stratum corneum. So imagine then how dull your skin looks when you're not exfoliating properly. But also think of the complications that dead skin cells can cause, and those are traditionally breakouts. So really dull, dry skin, breakouts on the face, but also the microdermabrasion device is just a staple within a practice, staple for prepping the skin for everything else you're going to do to it, for a couple different reasons. So first generation used the crystals. What we use are diamonds. And the next slide will actually show you all of the tips that come with our pristine device. So the diamonds, think of it like a piece of sandpaper. When you go to Home Depot to pick out your sandpaper, you're thinking, how much do I want to sand? Let's say it's a piece of furniture. Do I really want to sand it down really roughly, or do I just want a very fine sand? And the sandpaper is going to look and feel very different. When you want a very gentle sanding to furniture, it's going to be smaller sand, but also a ton of it on the sandpaper. On the opposite end, if you need a really coarse sanding, it's going to have larger pieces of sand, but not very many of them. So we do the exact same thing with our tips. When we want a very aggressive exfoliation, let's say it's really thick skin, problematic, oily, scarred skin that we really need a good exfoliation to, we're going to have larger diamonds and not as many of them on the tip. Now, if it's somebody a patient who's in their 70s, maybe 80s, thin skin, of course you don't want to do that to their skin. You want something very fine. Then it's smaller pieces of diamonds, but also a lot of them on the tip. So that's how we get the different coarseness, dependent on the type of patient that you have. So age and also how problematic is their skin. Is it dry? Is it oily? So on and so forth. But the big thing with microdermabrasion and with our microdermabrasion is that it has a vacuum. And the vacuum is going to increase microcirculation. When you increase microcirculation to the tissue, we get overall healthier skin. When we get blood flow to the skin, we also get nutrients and oxygen to the tissue. So right there, it is making the skin healthier for everything else you're going to do right after it. So a quick microdermabrasion, 2 passes on the skin, remove that some of those layers of the dead skin in the stratum corneum barrier. So we get better penetration of RF if you're using radio frequency, heat-based technologies, or if you're using light-based technologies like your IPL or lasers. Light naturally scatters off the skin. So any type of light-based technologies, it's better to remove as many dead skin cells as you can so you get better absorption of that technology. But also because you're increasing microcirculation, all of those technologies are just going to work better with healthier skin. So that's why really microdermabrasion is a staple within a clinic. Now, why it's so popular with millennials is it's exfoliation. Of course, this is one of the first things that we start with when we start going to a med spa. We typically will start with a facial, and then we move to a microdermabrasion, and then we move to all of the other, fun things like radio frequency and IPL. But it's an exfoliation that can be done monthly to keep the skin just overall healthy. The skin glows after. The pore size decreases, It helps with acne, problematic skin. It helps with acne scarred skin. And when they feel their face, it just feels like a baby. So it's really one of those treatments that are the first that is really sought after for younger clientele. Okay, so now we will show the tips. So here are all of our tips that Viora offers. And we have, I'll start at the bottom just so it's easier, and then I'll go to the top. So the bottom tips are your just typical size for the face. And then we have our different coarseness. So the 75 is going to be the least amount of diamonds on the tip. So it's going to be very coarse. Then it goes all the way down to our very fine tip that has a ton of diamonds. They're not cut as large. So we can treat, our older clientele that has maybe thin or dry skin. Typically, the ones here in the middle are used the most because most of us fall into that kind of middle area. Then we have our special tips up top. This one is going to be just smooth. There's no diamonds on it at all. And what that's amazing for is, especially if you live in an area where you have really bad allergies, this is great for sinuses. It's great for when allergy season comes around in the spring and we get really stuffy and congested. The smooth tip can just help drain all of that excess fluid that's built up in the face. So it can be used outside of just exfoliation. These two tips are going to be, the small ones are going to be for the eyes and the nose. So the teeny tiny one, I love to just come into these small areas around the nose. I actually use that one to scrub out all of the blackheads. What's really fun is if they have oily skin and they have a blackhead, you can put it on the blackhead and do a little twisting motion, and with the vacuum, it just pops it out. That's always fun. And then the size just a little bit larger than that is perfect for around the eyes. So you could do the eyelids, helps makeup go on really nice and smooth, right under the eye, the crow's feet area. And these can be done on the lips too. So just think about, like, sometimes our lips get so dry and so cracked. It's wonderful for that. And then we have two body sizes. So that's going to be great for ingrown hairs. So doesn't matter the age, a lot of people can suffer from ingrown hairs, especially African American males. When they're shaving their neck, many times they can suffer from that. So you have the option to really help decrease those ingrown hair issues. You can also use the large tip before you do like a cellulite treatment because it helps increase circulation. So when you go in with radio frequency, there's already a bit of heat build in the skin. And again, the skin is healthier because you get that overall oxygen and nutrient to the tissue, so you have healthier tissue to work with. So really a wide array of tips and things that you can do with it. Also, KP, Keratosis Polaris, where we get it right here behind our arms. Women oftentimes get it in between the thighs, and usually that starts to show in the teens and when they're in their 20s. And, they don't like it, of course. It's little red dots, it's very bumpy. And the only thing that can be done for KP, unfortunately, because I have it, is exfoliation. So this is going to be great for that. Just exfoliating them every couple of weeks until you can get it under control. So you can do a lot with microdermabrasion. All right, so that's the first one. And then here I just added a one before and after photo after each of the technologies. But here's an idea of after one microdermabrasion, not only are her fine lines and wrinkles, they look much better, but you can also see what I was talking about, that overall glow to the skin. It just looks healthier, right? It's not dull, it's not dry, it's glowing. The texture has improved. So that's what to expect with microdermabrasion. All right, so the next one we're going to talk about, very sought after with younger clientele, is going to be body contouring and cellulite. So since I don't have all the time in the world, which I really wish I did, because I love going into the clinical side of all of our technologies, which today I just don't have time to do that. But we do have YouTube videos, so I'll talk about that at the very end, that you can, dive deeper to learn about the technologies. But what I'm really going to talk about is cellulite. So the next slide here will show just kind of some before and after photos at the bottom, but what I'm going to focus on are the 2 photos at the top. So our technology that is built onto that platform system that you could add or not add, it's called the V-form. So the V-form, we have 3 tip sizes with the V-form. It's actually right there, but it's not in my range to grab it. I wish I could. So the small tip, it's about this big with 4 electrodes. So it's using multipolar radio frequencies. So what that means is the more electrodes we have on the tip, the larger we can make the tip. And it's also a lot more safe and a lot more comfortable. The first generation of RF that came out was monopolar. Monopolar was incredibly uncomfortable. The reason being is monopolar, there's 1 electrode on the handpiece, and then you had to use a grounding pad. Usually the grounding pad was placed on the back. So the problem with it, though, was you had to use really high amounts of RF energy because it would have to scatter throughout the body to find the grounding pad. You would also have more contraindications. For example, if somebody had a metal knee and wanted their abdomen done, they couldn't do it because the RF wasn't controlled. But also the really high amount of energy made it uncomfortable, but also could create adverse, meaning it could create permanent fat loss, permanent divots in the skin that was unwanted. So Viora, we have the 2nd generation of RF. We have bipolar and multipolar. So bipolar is the handpiece I'm going to be speaking about next. Bipolar means there's 2 electrodes on the handpiece, so no more grounding pad. The RF energy, because radio frequency has to deliver and then receive. It has to go from a positive to a negative. So the monopolar, the positive was the electrode on the handpiece and the grounding pad was working as the negative. With ours, we have 2 electrodes on the handpiece, so it's going positive to negative. So it's very controlled. So we have to use relatively low amount of RF energy to get the temperature we need, but very safe. If someone had a metal knee and they wanted their skin tightened on their lower face, let's say, we can do it, no problem. And it's also going to be very comfortable because of those 2 electrodes being very controlled. With the V-form, the small tip has 4 electrodes. So it's still working in a sense as bipolar energy where it's delivering and receiving, but it's just delivering, receiving, delivering, receiving. So we can put more electrodes on the handpiece to build better heat and quicker heat. Our medium size is about, I would say, that big, and our large size is about that big. So the large has 6 electrodes on it. So we can treat a full abdomen and their flanks all in one treatment for 20 minutes because we have such a large tip size. But it's still comfortable because it's still working in a sense as bipolar energy. It's just delivering, receiving, delivering, receiving, delivering, receiving. So comfortable, but also can treat much larger BMIs, much larger areas. We can do a woman's legs for cellulite. We can keep heat on both legs at the same time. So instead of what would be a 45-minute treatment is now a 20-minute treatment. Now, I'm going to focus on cellulite and how you properly treat cellulite and why that's so important. So, of course, millennials are going to be seeking this. So we want to make sure that they're happy, they're getting the results that they want, and how are we able to do this? So with our V-form, we have something called core technology where we have different frequencies within the RF. That means we can target different depths of the tissue. So we have a frequency that can go deep in the fat. We have a frequency that can go into the reticular dermis where our collagen is, and we have a frequency that can go in the papillary dermis, also where our collagen is. Why that's important. So over 86% of women have cellulite and under 8% of men do. So unfair for the women that are on the webinar. And for the men, you guys are very lucky. But the reason is our hormones are different. And also our collagen and our septae are different than men's. Men have a lot more collagen than women. and their collagen is stronger too because of the way it's built. So if we look at our septae, which is the connective tissue bands that houses and holds all of the fat cells in the subcutaneous. So women's are shaped like a U, so it's open to the dermis, like the photo you're seeing here, and men's are shaped more like a diamond. So it's more controlled and doesn't really have the ability of those enlarged fat cells pushing from below, where women's definitely have the ability because there's nothing there, it's just open. So when our fat cells grow and enlarge, they start to push on the septae. The septae, they're supposed to be nice and fluid, and they're no longer fluid because they're being pushed on, and they become very rigid. So the rigidity is what pulls down on the skin. So that immediately is giving us a dimple, but also the fat cells are enlarged and they're pushing from below, and that's also giving us a dimple. So we can't just treat the fat. There's a lot more that goes into it to be able to give a really smooth appearance. So with our deepest frequency, we go into the fat, we shrink the fat cells. Now they're sitting nice and low at the bottom. And then our vacuum. So we have a strong vacuum on the V form, and the vacuum with the heat is massaging the septae. So they're no longer rigid and pulling on the skin. Now they're nice and fluid. And then these last two frequencies, the more superficial ones, are building collagen because we're putting the heat right where the collagen layers are. So now think about that. We're shrinking the fat so it's nice and low, it's sitting low, not pushing from below. Then we're massaging the septae so they become nice and fluid again and no longer pulling on the skin. Then we're building collagen, so we're thickening the skin. So all of that, thick skin to really help push down small fat cells, nice fluid septae. That's what creates that beautiful smoothing appearance, of course, that we want as millennials, as younger clientele. And cellulite is a treatment that I would say 70 to 80% of our offices that do V-form for cellulite are for younger clientele. When we get into more of our like 50s and 60s, that's when it's more of the loose skin that bothers us. And this handpiece also treats loose skin on the body. So like post-baby belly or just aging skin and it's getting loose. So it does have the ability, the handpiece has the ability to treat that. It's just your age, right? When they're in their 20s and 30s and 40s, they're looking more for cellulite and contouring. And then our older clientele, they're looking more so for the skin tightening ability of the handpiece. So definitely something that you're gonna need to offer in your med spa or office practice if you don't already, for really grabbing the younger clientele. They really gravitate towards this type of treatment. And then I just wanted to add a larger photo of what I was speaking on. This is after 2 treatments. We typically are recommending 4, possibly 6 if they have more of like the grade 4 cellulite. But you can see, you know, how well it does work even after 2. And then contouring. I know I didn't talk a lot about it, but it also does contouring. So you can see this is after 6 treatments, a huge difference because we're really able to focus on that fat and shrink the fat cells down in the area. Okay, I was just doing a quick time check. So next one I'm going to talk about is one of my favorite things to talk about, and it's our, I don't want to say new protocol because I guess it's not super new. It's been around for a couple years, maybe 3 years now. I feel like 2020 is like not even a year. So whenever I say, oh, it's 2 years ago, it's actually 3 or 4 years ago. So it's been around, and it is one of our most popular treatments, and it's called Plump Rf. So this is the handpiece I was talking about. That's the bipolar. So it has just the 2 little electrodes here, and this handpiece can truly be used from head to toe. You can treat the forehead, you can do an eyebrow lift, you can treat the loose skin on the lids, you can treat under the eyes, you can treat, we even use this to treat the labia, hands for tightening. But I'm not going to focus on that today. I'm going to focus on, because it's millennials, what it can do for the lips. So using bipolar radiofrequency energy, what we're doing is we're building heat. And when we build up enough heat, we create a little microthermal injury to the tissue. Not something we can see because these are all completely non-invasive. They look better when they leave instead of look worse. But the body knows that there's a thermal injury there. And what does it do? It stimulates fibroblast cells. Fibroblast cells then run to the area and start to secrete collagen fibers, which are amino acids. And it takes about 3 to 4 months for collagen to fully remodel. So they're typically coming in every 2 weeks for this treatment. And by the end of their series, they're going to start noticing the long-lasting result. So I'm going to talk about the pros and cons from filler, because we know we can plump the lips with filler too. But the results here are years to come. Reason being is we're completely remodeling collagen in the area. So collagen is a long-lasting protein. So really, really great. We break down old collagen, replace it with new, and we get a natural plump to the lips. Does not hurt. And I'll show you some photos so you can see the difference. So we named it all the plump without the poke because we don't have to use injectables for this treatment. With the VST technology, we also have that core where we can target exactly where the collagen is wherever you're treating. So we're not going to go super deep in the lips because we want to be right at the collagen layer, not deep into the fat. So we need that controllability of choosing the correct frequency of where the collagen is in the area. So for example, when you're treating somebody's forehead, that's bony and thin and superficial. You wouldn't want to use that 0.8 megahertz. You would want to stay at 2.45 megahertz because it's thin. But on the opposite end, when you're treating a younger patient's cheeks for like a cheekbone contouring, then you're able to go deeper because their collagen, their reticular and papillary dermis, that's where our collagen is much deeper in the fleshier parts of our face, like younger, let's say she's 25 and wants a cheekbone contour, that skin is thick. So we need the ability to go deeper. With the lips though, we stay more so superficial. So here are the photos of one treatment, an example of what one treatment will do. Now, we don't recommend one. It's always a series because it's non-invasive. We need a build on heat, therefore a build on injury, therefore a build on more fibroblast stimulation. So it's typically 4 to 6 treatments, but what's so great about this and why it's so popular with millennials is think about how many come in wanting larger lips because that's the thing, right? They're on social media, celebrities, they want to look like Angelina Jolie, they want to look like Kylie Jenner or Kim Kardashian or, you know, whoever else has the large lips. But maybe they're nervous that filler isn't going to be right for them. They may be scared that it's going to not look natural and they want a natural look. They're scared to death of needles. There's so many factors where the ST can come in so handy. When you may lose a filler client, you won't lose them with the VST because it's natural. It's their own natural collagen. It's going to look natural and the results are going to be long lasting. But also I want to mention, if they can still do filler too. So you can do a series of the Plump Rf treatments, 4 to 6 treatments. After you're done, they may say, oh, no, I'm happy. This is the plump that I wanted. This is as big as I wanted them to be. Or if they still want a little extra, if you're going to do filler after, the results are going to last longer because collagen is going to be fully remodeling in the lips, even after you put the filler in. And additionally, you're not going to have to use as much filler, as much product. Therefore, it's just going to look more natural anyways. So it's a positive with or without filler. But you can see the difference there. So a couple things that it does. One, it's going to naturally plump. 2, it's going to help with any type of the perioral lines that they may have, the straw or smoker lines, or just genetically, they get the lines around the mouth. It also does a little bit of a lip flip. So without having to do Botox, I shouldn't even say a little bit of a lip flip. It does a big lip flip without having to use Botox. And then my favorite thing about it, which is kind of going off of millennial, is when we get older and we start to get the downward droop to the corners of the mouth, because we do the treatment all the way around the mouth and then right on the pink of the lip. So because we do it around the mouth, it's just going to lift the corners of the mouth. And we can start to get that downward droop even in our 20s. So it really lifts those corners, which is really nice. But here's an example. Oh, and also it helps the color of the lip because there's microcirculation in the area too. This is something that's always really popular for clients that have something going on that weekend. So they want to schedule on a Friday because, you know, their reunion is on a Saturday, or they have a date, or, you know, whatever the young generation is doing nowadays. But it is definitely, you look great when you leave the office with this. And then I have a before and after photo that just shows this a bit larger, because the other ones were a bit smaller. So a bit larger, so you can see how much it plumps, how much it helps the coloring of the lip. Her lips just look healthier, right? They look more alive. So really beautiful. Okay, next we're going to talk about, let me do a time check. Okay, so next we're going to talk about the IPL. Now this is huge for your millennials for so many different reasons. But the first thing I'm going to talk about is, I believe is going to be skin rejuvenation. But I want to show you the list of everything that this one handpiece, this one technology can do. It can treat hair removal for every skin type, even up to skin type 6. It can treat hyperpigmentation. In our 20s, we start to get those sunspots because maybe we weren't so good when we were, you know, younger in our teens and sunbathing, and that's when that solar lentigo starts to pop out, is in our 20s. Skin rejuvenation, that's huge. I'm going to really talk about that in depth. Vascular lesions, fine lines and wrinkles, and then acne clearance. Of course, that's going to be very popular for your younger clientele. So really the things I want you guys to focus on is hair removal. Of course, we typically start with laser IPL hair removal in our 20s. Hyperpigmentation, yes, that's when melasma can start coming out. That's when our first signs of sun damage start to appear. Skin rejuvenation, absolutely. We'll talk about that in more depth, but acne clearance, that's definitely something for your younger clientele. So how are we able to treat all of these different things with just one modality? And it's because the IPL, and again, I can't fully go into the science of it because I just don't have the time, but the IPL is attracted to many different chromophores, where a laser is only attracted to 2 or 3. The IPL is attracted to really all because it's in the visible spectrum. So it's attracted to melanin, so that's how we're able to treat for hair removal. It's the pigment within the hair, but also melanin, which is the overabundant amount of pigment that is in our skin. So things like melasma and solar lentigo, sunspots. Hemoglobin, that's how we're able to treat all of our vascular lesions. Porphyrin is found in P. acne bacteria and highly light sensitive. And then water. So what we're really going to be talking about today is the water in our skin and what we can do for our skin because it is so attracted to the water. Okay, so I get this question a lot. What would be the typical treatment that you would recommend for somebody that walks in and they're 25 years old and they don't know what they want? They just know that they don't want to age quickly, right? They just want to slow down aging. They want to keep a beautiful skin they have at 25, but they want to start something. What would you recommend? This is always my go-to because it does so much. So the IPL skin rejuvenation is attracted to the water in our skin. And what do we have a lot of? Hopefully is water, especially when they're hydrating before the treatment. So because it's attracted to the water in the skin, it's going to heat up all of the skin cells. And IPL also has the ability to go deep into the collagen. So it does a few different things. One, it goes deep into the collagen layers and helps stimulate collagen. So there's your preventative measure. Two, it goes into the more superficial keratinocytes, which are in the epidermis. Those are the cells that turn over every 28 days. The type of heat that we're using with the IPL is 60 to 70 degrees Celsius. This is the temperature we need for coagulation. When we get coagulation, we get necrosis or death. And that's what we want. We want death to those cells. I know that sounds weird, but when we get death to cells, what does the body naturally do? Rejuvenates. So we get new skin cells to the area. So what is that going to do? That is going to, it increases collagen. You have poreless skin, and then you get the glow. So that's what I really want to talk about here is the glow. So, well, I'll talk about that next. First, I'll talk about the poreless skin. Why? Why does it shrink pores so well and so easily? The IPL skin rejuvenation regulates sebaceous glands. It regulates sebum. So when someone's really oily, the oil is what is stretching out our pore size. So that's why we have enlarged pores. And I know that for a fact because I have very oily skin. I had tons of acne scarring before I worked for Viora. But when we regulate the sebaceous glands and the sebum, then the oil is reduced, and then the pores become very refined. So really, really helps with that tremendously. The texture, the tone, the pore size, collagen increases, but the glow. So that's what millennials are looking for, right? It's almost like they get so used to filters on their phone, you know, that the younger generation is filtering out everything because they can. They take a photo, they don't like because they have big pores and they don't look glowy and dewy. They pop a filter on and all of a sudden it gives them that. That's what the IPL does. It gives them that glow, but in everyday life. So this is always the technology that I say, if someone's gonna start young, do this. It's gonna increase collagen, so great. It's gonna keep their skin tight and thick. It's going to give that poreless look. It's gonna help oily skin. It's going to make the skin glow and just help with the overall dull skin look. And it also, at the same time, will target hyperpigmentation. So if they get those first signs of sunspots, it's gonna take that away as well. So this is the go-to for the millennial treatment. And this can be done once a month for life. You can have them on a treatment program that they know every month they come in and every month their skin gets to look like this. So really, really phenomenal. This is also a great treatment for maintenance. So let's say you were treating older clientele with maybe a bit more of a minimally invasive approach, but you don't want to necessarily, or they don't necessarily want to maintain with that minimally invasive approach. They can get on an IPL skin rejuvenation regimen once a month, and it will just help maintain those results. So it really is just kind of a treatment for any age. Okay, so now I'll show you some before and afters. So I added before and after photos for everything that the IPL can treat. So here's an example of melasma. This is a younger client. Melasma happens a lot of times with pregnancy, right after childbirth, and of course, people in their 20s, girls in their 20s, many times are having babies, so they can suffer from melasma. So you can see how well it works, but also I want you to notice the texture of the skin, the pore size that I was talking about, and the overall glow to the skin, right? It just looks healthier. All right, next one is rosacea. So of course that can be at any age, people can suffer from rosacea. So yes, it's helping the rosacea, but also notice the texture, the glow of the skin, the overall evenness of the skin. It just, again, looks so much healthier. And she's young, she's 27. Acne, of course, that's going to be very, very popular for younger clientele, and you can see how well the IPL works for acne. Hair removal, yes, typically patients are starting in their 20s. This is after 5 on the underarms. Typically, we need about 6 treatments for hair removal. Facial, for sure, is going to be very, very popular. Okay. So now we're going to talk about the Dermafuse. This one I spent a bit more time on. Let me have my time. I need more time. Okay, I'm going to try to hurry with this one. Dermafuse, it's our brand new device. It just came out about 6 months ago, and we are so excited about it because it is the one device that can truly infuse serums into the skin. How and why? Okay, so I'm going to break down the technology quickly. So so we use a technology called IonFuse, and that is our proprietary algorithm for human skin. So what I mean by that, this uses electroporation. Electroporation has been around since 1909, and it was developed by a German professor in 1909 who wanted the ability of putting DNA into a cell without having to puncture it. Because you can put DNA into a cell with needles, but he wanted to find a way of not having to puncture the cell, and he came up with electroporation. So Viora is now using it in a cosmetic way, where we take serums on the skin. It is zero pain to this treatment whatsoever. And what it's doing is it's opening, there's a lipid bilayer around our cells, and it's creating openings, channels through our cells, so through a melanocyte that produces pigment, so we can stop hyperpigmentation, through, or I shouldn't say through, into a fibroblast cell. A fibroblast cell's job is to produce collagen. So we can take these serums and not only just infuse it into the skin, not only just go into the superficial part of the epidermis, we go deep. We can go 10 centimeters deep. We even have a serum for fat where we can take ingredients and put it into a fat cell to tell the fat cell to break down, and then the body naturally gets rid of that fat. So we can go deep. Not only can we go deep, not only can we create microchannels through that strong stratum corneum barrier. Once we get through that barrier, then it finds the cell, opens it, puts the serum inside the cell, and then when we're done doing the treatment, the cell then closes. Oh, it's just amazing. I wish I had an hour to talk about this technology to explain it even better, but we're super excited about it, and the results have been incredible. But it's something that you can combine with all of the other modalities. So for example, you can do the pristine microdermabrasion, then you can do IPL skin rejuvenation, then you can infuse serums. And that's when your millennial is incredibly happy with you and coming back every month for sure. Okay, so our serums, we have one that's intensive hydration. I won't break all of this down, but it is primarily hyaluronic acid, which is a glycosaminoglycan. It's naturally found in our skin. So we're able to naturally put hydration back into the skin. We can use it right over the lips to plump the lips naturally, put HA into the lips naturally. So now think about doing the Plump Rf, then the Dermafuse, and how beautiful the lips look. This also can be used to extend the life of filler. Once the filler starts to kind of degrade, I don't know, 6 months, a year later, and they're kind of like, oh, I don't see it as much. They can come in and do this one, and it plumps it right back up because it's HA and it's going to be attracted to the filler. So it's like, oh, I just got filler today. This is great. Here's a before and after for dry skin. You can just see it gives a life to the tissue, and also it plumps it. So this is great for your older clientele too. We have collagen boosters, so it increases the fibroblast cell stimulation because we're using ingredients that fibroblast cells need to thrive, which is vitamin C, hematite, which is iron, hydrolyzed collagen. I wish I could spend a lot of time talking about those ingredients, but I can't. But we do have webinars on it on YouTube, so you guys can always watch those to learn more. But here is the result of collagen booster. So again, your younger clientele can start with collagen booster early, so they don't have to do those really invasive treatments when they get older, because they're doing just very minimal things to their skin, but it's also a lot to their skin to keep it healthy and tight and young and youthful. Bright, we're using ingredients in our serums that are tyrosinase inhibitors. So it's telling the melanocytes to back down, stop producing so much pigment. Things like kojic acid, alpha arbutin, licorice extract, those are all tyrosinase inhibitors. So it helps to balance pigment. It's really, 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 really good for melasma. So here's a photo of a patient with melasma, how well it works. These treatments take 10 minutes. There's no pain, but it makes a dramatic difference to the skin. Smooth is going to be for acne. So it's has ingredients, the Canadian white willow bark, Evermat witch hazel, which are the anti-inflammatories, antiseptics, astringents, antibacterial, antioxidants that the skin needs to help fight acne. So now you can think the combination there. You can use the pristine microdermabrasion to get rid of all the dead skin cells that are causing the breakout in the first place. Then you can use the IPL to fight the acne, but also regulate the sebaceous glands. Then you can use the Dermafuse right after to put all of these ingredients into the skin, and that's where you get very, very happy patients, because you can get acne under control very quickly with doing combinations. So there is a photo of just using the Dermafuse after 2. Okay, so since I've already jumped and started to talk about combinations, this is kind of short because I wanted to briefly touch on another topic too, but because I've already kind of been talking about combinations as we've been going. But why combine treatments? One, you're getting customized treatment plans. For example, if a 30-year-old, two 30-year-old girls walk into your office, are they always going to need the exact same thing? No. And when you're able to customize that treatment plan, that's when they are incredibly happy, right? It's not just a cookie cutter approach that everybody gets the exact same thing. That's just not how we are. We're all so very, very different and have different needs. So being able to really stack treatments on top of one another is really fantastic, and getting them more to that surgical result that so many people are looking for because it's quick. You're able to get there because you're combining all of your treatment capabilities and modalities. Better results for sure, therefore patient retention and more revenue and profitability because you have incredibly happy patients that are also telling all of their friends and family. So for them, it's all about me, right? Make me beautiful, give me what I want. What to combine? Everything, for sure. Like I said in the beginning, the pristine, the microdermabrasion, that's a staple within the practice. That's just something that's going to prep the skin. It's removing the dead skin cells and it's making the skin healthy. Great. Now you can go in with everything else you're doing. But you know, think about when you're doing the microdermabrasion for exfoliation, then the IPL for skin rejuvenation, then the Dermafuse, and maybe 6 months down the road, now they want to combine, they want to do their injectables. You know, all of these things, because I'm not saying stop Botox. No, of course, like we want to continue that as well. But for example, like Plump Rf, you can do 6 treatments of the natural approach, and then if they want a little bit more, you can. So that is combination as well with filler, which probably you're already offering in your clinic. Microneedling can be stacked after all of these treatments at the very end, just to give a bit more of a punch for acne scarring, for overall preventative prejuvenation, skin tightening. We have modalities that can do that. Typically when they're millennials, they don't need that, but we're making sure they don't need that by using the microdermabrasion, then the IPL skin rejuvenation, then the Dermafuse to boost the collagen in the area. So really, I can go on and on. PRP can be added. And then, of course, doing their cosmeceuticals at home is so very important. Make sure that you're talking to them about that in consultations, because they should be doing their own homework at home, right? You're doing a lot to them in your office, but then when they leave, you want to make sure that they're taking care of their skin at home, wearing sunscreen, number one, drinking a lot of water, number two, and then all of their awesome skin products. Okay, so just keep that mentality. Combine everything. The results will be tremendous. All right, I'll just give one more example, the lips. So doing microdermabrasion over the lips, creating microcirculation, removing the dead skin in the area, then doing the Plump Rf over the lips with radio frequency, then doing intensive hydration with Dermafuse. The results are really, really beautiful. Okay, so now I'm going to just quickly speak on memberships. So why do memberships? For a couple different reasons. How I'm going to talk about it today is memberships for millennials is really the affordability. So you can see I put a lot of bullet points here. They get discounted treatment prices, so affordability. They get great results. They have a sense of belonging to your med spa, to your office. They get to see you every month. And then for you, you have predictable revenue for sure, because you have so many people on a membership that are paying this much a month. You know how much you're making. They're very loyal to you because they are in that membership. And then they're always in your office every month. So when you offer then some like a new technology or a new whatever, they see it, right? They visually see it because you'll have a roll up or you'll have flyers or you'll be speaking about it to them. So it's just, you want to see them as much as possible. But here are just a couple ideas of memberships that I have created for our Viora customers. But what I really want to talk about and not take up too much time on this is because I actually did a webinar on memberships and loyalty programs. So that's on YouTube. You can always watch it. But it's the affordability. When you're talking about millennials in their 20s, they probably have student loans. They're probably not in a career where they're making over $100,000 a year. You know, there's a lot less money when you're younger, of course. And with that, they may want they may want all of this stuff, you know, and then you lay out the price and it's $1,500 or $2,500 and they're like, oh, I can't afford that. Okay, can you afford $149 a month? Oh yeah, that's easy. Great. This is a great way of really attracting millennials to be able to afford it, but then still get the great results. And all of the treatments I spoke about today, those can be done monthly. So it fits beautifully into a monthly program. So this is a monthly membership I did. I'll just kind of briefly go through and just show you. This is a seasonal membership I did where they're coming in once a season to do skin rejuvenation. This is one I made, it's called Glam Fam, where they pay $250 a year and then they just get discounts on every single thing that you offer. Hair removal membership, great, because you know they're starting younger for hair removal and then you're making it affordable. And then that's it. So I did an hour. I didn't go over an hour. I'm so happy. I was like, oh my gosh, I'm gonna go way over.
Right on time, all good. I tend to speak just as long as you do. So I must say, Kara, and for those of you who have attended webinars of mine in the past, I speak alongside a lot of people in the industry, and I have to say you are probably one of the most passionate people that I do webinars with, and I truly mean that. I think you are such an expert and you articulate everything so well, and I just have to say you are definitely one of the best speakers that I do webinars with. So I just want to say thank you so much for spending some time with us today.
Thank you.
So I'm going to leave a minute or so for some questions. So for those of you who guys are on and have any questions for Kara, feel free to just type them in the question chat box on the lower right hand side of the webinar dashboard. I'll give you guys a minute or so to do that. In the meantime, I just wanted to hit on a couple of incredible points that Kara touched on. Everything that Viora, like all the treatments that she's talking about as it relates to attracting millennials, a lot of these treatments are definitely great, what I would call gateway treatments into upsell, cross-selling other complementary treatments and procedures, or putting them on, a comprehensive treatment plan with combination treatments. Membership programs are huge, huge, huge. I am so glad you touched on that because I'm going to be talking about that as well. Membership programs are so effective, especially when it comes to millennials. I think a really big thing that separates, an average practice from a great practice in terms of just, if we're just talking about the millennial demographic, let's say, is what's your retention on those millennial consumers? Because the majority of patients, your most profitable patients will be repeat patients, not new patients, right? And membership programs are such a great way to retain those millennial patients in your practice to make sure that they stay therapeutic throughout the year and that they keep coming back to your business. So could not agree anymore with everything that you touched on, Kara.
Well, that's wonderful. I forgot to say too, if you wanted to contact us, if you have additional questions, the best email to use is info@vioramed.com. Again, that's info@Viora, V-I-O-R-A, med, like medical, med.com. And then also like our Instagram, it's Viora. You can always direct message us. If you wanted to watch the webinars where I really break down the technologies, it's very in-depth. So if you really want to learn more, we have our YouTube channel with all of those, and that's Viora videos. If you wanted to watch more on YouTube.
Thank you, and I encourage everyone to watch those. We had a couple of questions come in all around membership programs. For the first was someone's requesting you go back to the slide showing the membership. Oh. Maybe if you want to pop up one of your favorite, let's say. And then we had another person ask, where can we find more about the seasonal memberships? Is there an additional webinar they can watch, or should they just reach out to you directly?
I actually did a webinar on memberships. I know you're going to learn a lot more too with Audrey right after this. And then with the ones that I have created for our Viora clients, I did a webinar on that. So you'll see all of those on that YouTube.
Okay, so they can just go to the Viora Med YouTube channel. Is that right?
Exactly. Yep.
Okay, perfect. So I encourage everyone to go check that out. Looks like those were the only two questions. But once again, Kara, thank you so much. I mean, every time you speak, I feel like I learn more things. I honestly wish my provider had a Viora device in her practice.
Or if you lived here by me.
I know, right? Absolutely. So thank you so much for your time, and thank you everyone for those of you who choose to stick around for the second session. So thank you so much, Kara.
Thank you.